I'm assuming we're live.
Welcome, everyone, to another Holistic Vet Sisters. We're back again. Thursday comes around quick, doesn't it? Certainly does. So, today we are here again at 6 p.m. to answer your questions and to hear from another Holistic Vet Sister. So, we're with Brigitte, and she has a very busy practice over in Denmark. And Brigitte is also what were you saying, Lisa? She is the most
I was
senior
saying beginners the most
veterinary
the
acupuncturist in the world. Have I
yes,
got that right?
I stand by that. Beginner is the president of the International Association for Veterinary Acupuncture. So we have a president with us. We've had presidents before, we've had beginner before, and we've had other presidents, but we should mention it when we have a president in the room, I think.
Absolutely, absolutely. I think also because acupuncture, there's lots of acupuncture vets that kind of deal with pain only. So we're quite lucky in the UK, especially. I don't know what it's like across Europe, but certainly in the UK, there's lots of acupuncturists, veterinary acupuncturists, but they mainly only deal with pain. So to have somebody who understands it from a whole body perspective, I think is brilliant. Yeah, we need more people like you.
Thank you. Thank you. I'm
Do
really
you have
happy
any,
being here.
sorry, no, I was going to ask Birgitte, I haven't thought about that, but it's a good point. Do you know what the proportion, I mean, there's lots of vets who do acupuncture from a Western approach. Do you have any idea of the proportion? How many are most acupuncture vets proper TCM trained, or are most,
Mm.
I suppose
It,
it's
it's
difficult to know.
difficult to answer because I know in Denmark, for instance, where I come from and you come from, Lise, they take the acupuncture exam through IVAS, and we teach the TCM, so they can use it if they want to. But in the beginning, it's difficult to use the TCM because it's quite another way of thinking of health and sickness. And so it can be easy just to give some local needles in an area that you know is painful. But you gain best results if you use the TCM and the holistic way of thinking, where you take all the symptoms in consideration. Um, but it's hard to say how many does it because I know a lot of veterinarians that are chiropractors. They use it, but I don't think they use the TCM
Mm.
approach that much. So, and I know that people find it difficult to keep on thinking about the TCM because if you're not in a practice where you can spare with somebody, where you can talk about how is it, then it's difficult to remember to use the TCM. But I think we gain much better results if we do it like that. So
Mm.
Yeah. I think it's difficult, full stop, if you're trying to work where you're doing both. We've had that conversation a million times because pet carers are always asking, how can we, I need a local holistic vet. And my answer is always, no, you don't. You need a specialist in what you need. But I think it's almost impossible to hold that role. Apart from the fact that you can't be good at everything, it's also it makes you kind of schizophrenic if you're doing conventional stuff and conventional diagnosis and trying to think holistically. There isn't really room for they're
I
so opposed. It's difficult to hold both in the same.
yeah, I do work with both now, and it's like we were saying, like we're taking on a different hat. So I
Hmm.
can't really mix them all at the same time. It's very difficult because you need to switch over your mind completely. So it's easier when I go from one room and then I go into a different room only doing acupuncture, and that's kind of what I'm there for. But there is a quite hectic transition trying to do both. So, but obviously sometimes I try because there will be a lot of cases that comes in, and Western medicine a lot of time doesn't have answer for things. And then I'm like, okay, I can't think of anything there. Let me take my other hat on. Okay, what could this mean in Chinese medicine? And almost always, if I can't find it in Western medicine, I can find it in Chinese medicine, which I think is awesome.
Mm.
One thing
Absolutely.
I've noticed is that the spleen gets mentioned a lot in traditional Chinese medicine. And unless a dog actually seems to have a spleen issue that's been diagnosed, which isn't that often, You don't tend to talk about the spleen ever, do we? Certainly not in canine
No.
nutrition.
No, but it's because you are working with nutrition, and when we talk about the spleen in traditional Chinese medicine, is connected with the stomach, and the stomach and the spleen are responsible for the digestion, for transformation of the food. So it's so relevant. And the way that many dogs are fed today with dry kibble, it really injures the spleen more as a philosophic way to it's not like the normal or the way we were taught how the spleen is working. Because today the spleen is something that get a tumor and then we remove it, and what then? But it's sort of more a metaphor of the spleen and stomach together working, and the TCM brings in some other things about the spleen emotions, and that the spleen doesn't like when it's very humid and a lot of dampness, and it's sort of it's difficult to take out of context. But if you see it in an overall picture, it completely logical.
So the
But
spleen
takes
wouldn't be happy with yeast
no,
in the system at all, by the sounds of it.
yeah.
Doesn't the spleen rejuvenate the blood, though, in some way?
Yeah, exactly. But that's more the way of thinking. It is also in TCM, but it's also thinking Western or conventional.
Okay.
So
I like that way of putting it, that when you talk about spleen, it's not really about the actual anatomical physical spleen. It's more that the spleen is symbolic of a pattern or a, yeah.
Or the spleen chi. You need to work the spleen chi because that's
yes,
a
exactly.
pattern. Yeah.
Yeah, and
Yeah.
that's really a major problem for the dogs today. That spleen chi deficiency. So, and I understand that you meet that because when you are a nutritionist and work with diets, it's so important how the diet is to help the spleen and the stomach. And we also see it in TCM as the pancreas is part of this system as well, being part of the digestion. So,
Before we look at questions, Brigitte, I was really keen to talk to Brigitte about, you said you mentioned that you'd done a course. Tell us more about the topic that you're into at the moment.
yeah, it's something that really came to my heart that I had to do, and it was I have taken a program in animal hospice and palliative care, which I fell over by accident. I don't believe in accidents, but it's not about bringing. When you hear the word animal hospice, you can think about that it's taking your animal that is dying to a hospital and then it's supposed to die in that place. It's nothing like that. It's more a philosophy about taking extra care for the dog in the remaining time when it's got a chronic disease or and you know it's going to die within a short period. So you do something extra for the dog. You think differently, and I can come with some examples if that's relevant, but it's also about taking care of the dog's owner or the cat's owner, because we very, very often see that people get their animal euthanized, sometimes very acutely, because they've got a chronic disease or a diagnosis that is not good. And maybe the animal could live for much longer time, but the owners are they're getting into some kind of a shock state and they don't know how to act, so they very often the animal get euthanized. So it's also about how we speak with the owners, how we prepare them for something that is inevitable at some time, but not necessarily at this particular time. And the reason for me getting into this is that I lost two dogs very quickly, and it really shocked me. And I realized that the grief that I had after losing the dogs was very, very strong. and it really hurt me so much, so I couldn't work, and I was really amazed how much it meant. Because I mean, during my time as a veterinarian, I have euthanized many animals, also my own. But this particularly acute accident just completely ruined my life for a period. And then suddenly I could understand how animals owners sometimes have it. Because I meet so many clients that are grieving over their animals many years after the animal has been euthanized. And many of them, they also feel a lot of guilt because afterwards they think, should have had done it differently. Was there anything else that I could have done? I was not present for my dog when it was euthanized, and so on and so on. And I guess you have both, you have all met this with clients. So now I'm actually writing on a book, a self-help book, so people can get some advices about how to take this difficult decision about euthanizing their dog. What could they do differently? How can they prepare themselves? And also talking about the grief, and there are so many different kind of layers in grief. So how could they prevent, how could they prepare themselves so they don't get so deeply hurt? And so the book will also include a lot of exercises for the owner, and a lot of different stuff. So yeah.
That sounds amazing. I think it's such an important topic. And I think that it's one where vets very often are not able to be helpful, because I think I've really thought about it, because I mean, there is a point where it stops being a veterinary professional assessment and it becomes about personal ethics and personal approach to end of life. And I don't think how we approach that for ourselves and for our animals is necessarily very different. But it's certainly true that we all want to approach that phase in different ways. And it's important that the owner or the carer is met and are involved in that conversation. But vets are sometimes so practical and so goal orientated that they just want to solve the issue. This is my interpretation of why I often feel that animals are euthanized way sooner than they had to. It's almost as if as a vet, you think, well, I've diagnosed it, it's incurable, we'll euthanize. Then we've solved it, and then we've solved it somehow. You know, we've dealt with the problem, we've come up with a solution, we can kind of tick that box. And that's such a shame, because if I was diagnosed with a terminal illness today, I wouldn't say, okay, kill me. I would say, well, I really want to make the most of the time that I have left then. But very often with dogs, I find that that's not what happens. Dogs that have a perfectly good quality of life are euthanized because they have a poor prognosis. And I think so. I think that conversation that you're opening is really important about, well, okay, what do we do then? How do we get the most from that time?
Yeah. And especially because life is so precious, and there's nothing more easy than taking life. I mean, we have euthanized many animals, and it's easy, but it's also it's not a nice power to have, actually, because life is precious, and we want in our veterinary life, we are trying to prolong animals' lives and making them having a good life, a good quality of life. And it's just too easy just to take the life. And the consequences for the family around the animals is much more than we actually are aware of. So it can really have a deep impact on a person's life afterwards. And that has really shocked me, how much impact it does for people. And I have talked with a lot of my clients about this subject now. And they really think a lot about it. And yeah, I think it's very important. That's why it's so much present in my life at the moment.
I think it might be quite an emotional book for you to write.
It is. It is.
Yeah, yeah.
But I also think it's so important because I really want to support people because we are very often as vets asked, when is it time? Is it end of life now? Or what do you think? And we give our best advice. And I do so much agree with you, Lise, that many vets, they think, oh, we cannot do anything about it, so let's just make an end to it right now, instead of thinking, okay, could we do it differently? Or could we at least wait for a week or something like that, so the owners could sort of get used to what to do afterwards, how to take care of the body of the dog or cat, or there's so many layers and things in this, I
I
believe.
think also I've only really had to have cats put to sleep. And not Thomas. Thomas was very easy for me. I wasn't even as spiritually aware as I am now, but he came and laid on my pillow. I mean, he was like nearly 20 and he had been ill. I won't go into it, but he came and laid on my pillow overnight. And it was like he never had done that before. And it was like I just knew, I just had the knowing. And then with Mr. Floyd, that was more of a shock for me because he had been very much like Thomas. So I was basing it on him at home. And then when we got to the vets and he came out of his carrier, it was like he came back again and he was parading around and sort of looking, and I was like, oh goodness me, like he hasn't done this now for a good couple of weeks. And that was, we still went ahead with it because the vet was saying at the time, cats, when they're in a different area, very often they will suddenly have this kind of almost like, oh, where am I? And this fear within them, and they will go and seek their area out. And that he thought that's more what it was about. But I still have that niggle even now, that was that the right time? Did I judge that right? Two very different scenarios. But I'm at peace with the fact that it happened now. But yeah, it's interesting. Some animals, with Thomas, we'd had an incredible bond, and it was with Mr. Floyd. He was actually my grandma's, and then I took him on when she went into care. So I'd known him, but I hadn't lived with him. So then we only had him for a year and a half. So I think sometimes it's about that real soul connection you've got with your animal. You can intuitively know.
I think it's so important that we just shine the light on this whole area a bit more and talk about our animals dying, because it's kind of, for humans, it's more, I think it's more understandable on an emotional level. We will lose our parents, yes. Hopefully we won't lose our children. There's kind of an order to it, the generations past. But our animals don't fit that mold, because we will lose all of our animals because their lifespans are so short. I'm always joking that we should keep parrots and tortoises, because, kind of animals that you can hand down to your grandchildren when you get old. If you have dogs or cats, you're going to go through, they will die. If you get a dog 10 to 15 years from now, they will die, and they're supposed to die. But I find quite often emotionally that the carers are just not, they want to save them. I've had 2 conversations today with about very old cats. One was 15 and one was 17, that were very, very ill about this. And the owners, certainly at the beginning of the conversation, come from a place of fear and panic, wanting to force feed a cat that may or may not be dying, because he's going to starve to death and I need to save him. And that sort of trying to turn that around, but save him from what? He's 17. What's he supposed to be doing now at this stage? And are you going to help him and be with him, or are you going to fight him because you're scared? It's a very personal and very complex subject, but I think it's fantastic that you're bringing it up, because we need to speak about it more.
Yeah, I like to mention that there is actually hospices for animals. I know a British woman that's living in California, and she has had a hospice for many years. But it has typically been old animals that has been brought in rescue
Mm.
places, and she has actually let the animals die themselves, but under supervision of veterinarians, homeopaths. She's very fond of homeopaths, and and people who knows about nutrition. So it has been very peaceful. And during this program that I took, she was one of the teachers. She's such a nice person, and she actually showed us some videos about cats that were taking their last breath, and it was so different for me because being a vet, we have always been taught that we should euthanize. They're not supposed to die by themselves. Um, but this was actually quite powerful to see that it is possible that they can die by themselves. You just need a lot of caretakers and a lot of people around you to do it in the right way, but it is possible to do it.
I suppose you believe they're going to be in pain, don't you? And that isn't what you
Yeah,
want, isn't it? That's
yeah. And
coming.
people are afraid that they suffer, they can't breathe. But it's actually very peaceful. So
Yeah, I've done that a couple of times. Supervise somebody where the owners really wanted them to die naturally, and it's a very special time. And also I find the paradox really interesting. Why the difference between animals dying and humans dying? That sometimes I really personally quite strongly believe in the right to die. I think we should have the right to choose euthanasia for people, but it's just bizarre how, from my point of view, we jump to it so quickly for animals and we completely deny it to people, even where it's obviously would be the kind thing. There just seems to be a discrepancy there that deserves to be talked about.
yeah.
I just think as well that humanity, and under Rupert Sheldrake's morphic resonance and even epigenetically, we are so full of trauma, really, epigenetically, that we're and everything around us seems to be ebbing away our inner strength, using tech too much, for instance, not getting enough sun, not grounding ourselves enough, all these things, not drinking structured water, they're ebbing away at our inner strength. So coupled with what historically epigenetically has happened to us as people, as human beings, is it any wonder that we are finding, not that I'm belittling any of it, because obviously I've been through this as well, but it's, there's an inner strength to be thought about here as well, that we need to cultivate. Really, humanity needs to cultivate this.
But there's also just, and it's not easy, and it's not supposed to be easy, because of course it's grief and it's loss and we're sad, but it still, I think, has enormous value if we can accept the process and the fact that it is what needs to happen sometimes, so that we don't fight against it and act in fear and panic and give them steroids and feeding tubes and try to keep them alive, when clearly it's not what's supposed to happen. It's like either we cling on to them or we euthanize them. We can't just find a middle ground of I don't know, supporting
Do you
them
have a
through a
name?
process.
What is the book going to be called? What can we look out for?
I still only have a working title, so
Go on. We'll decide right now.
Actually, I started writing it in English, but then I suddenly decided to write it in Danish. So I think it's something about when is it time, and then a subtitle about this is a self-help book to get through the grief and to prepare yourself. Something now it's getting very, very long, the title, because it's not finished yet.
Okay. Well, we can.
What's the main? If you were to boil it down to just one piece of advice, like what would someone who's Like the two carers that I've spoken to today with very old cats who are absolutely in a frenzy because we need to, we need to save them. We need to keep them alive. What do you say? What's the most important message? Or in general from your book?
Yeah, but I would say that's actually why I told you about the British woman in California. That is that in the last stage of their life, they're stopping to eat. So I mean, it's okay that they don't eat. It's
Hmm.
part of getting old. It's part of going the natural way. So actually, I would prepare the persons that they should think about how this should go on. Should they euthanize them, or would they go all the way supervised? And what would they do afterwards? Would they cremate them? Would they have made jewels out of the if they are burned, cremated, and so on? So they sort of prepare themselves, but it's okay that it's end of life now. But what can we do to make it beautiful instead of making it to something horrible where they suddenly
Mm.
need to go to a vet they don't know in the middle of the night? That's another thing to think about. So it's not something chaotic. So they sort of get prepared. That's some of the advices in the book.
Can I can
Yeah.
I just add a question on that? What is your thoughts on, as I see this a lot of pet parents don't want to be there when their animal passes. What is your thoughts on that?
Yeah, my thought is that they have to be there.
But
They
it's
are
really
part.
funny because I've seen newspaper headlines that a lot of animal carers don't want to be there. I've never
Yeah.
had that experience.
No, but I have
I
heard
have
about it.
euthanized a lot of animals, but I've not had it happen once that they didn't want to be there.
Yeah.
You don't have that clientele, I think.
Well,
No,
but
but
even
I have met parents that didn't want to be there and just see the animal afterwards. But that's a shame. I think they really need to be there for the animals because the connection between the caretaker, the owner, whatever we call it, and the animal is so it's so important. I mean, the dog has been or the cat has been there for them all its life. So they're supposed to be there as well.
Yeah.
It's part of living and dying, being
but
together.
generally you'd give them a sedative first and
Yeah.
then, the euthanize them afterwards. So even if, I mean that sort of speaks to the bigger picture that I've increasingly feel that owners should be there when the animals are sedated or anesthetized for procedures, just to hand them in. I mean, it's not the same process, but it's for the animal probably feels like the same process, the first steps of it. That we wouldn't do that to children, that you just leave them at a hospital
True.
and then
True.
they're sedated and then they have whatever operation they need. And we just wouldn't do that. And I
No.
don't think we should do that to animals either. I think the owners should be able to sit there and hold them if that's what they want to do and it feels appropriate until the animal is no longer conscious. And then they can go and have their dental procedure or their operation or whatever. And then the owner can sit there when they wake up.
They were
Um,
doing that in the North Cyprus vets when I lived out there. They
some
certainly did
places are
that.
doing it, but
Yeah.
some places are absolutely refusing.
I
Yeah.
think
And
probably not in England. Go on, Tina.
My previous clinic actually did this, the first one I worked at in Norway. There's pros and cons to this. I think it's very nice for the animals. However, usually we send them home pretty rapidly after waking up, and we got a lot of callbacks that the animals were shaky, they were not, they were a bit sleepy, and a lot of questions because they see the whole process of waking up from anesthesia, which sometimes can be a little bit up and down, and they can look a bit ataxic or wobbly or
sure, and they can be howling and
yes.
yeah,
A lot
yeah.
of weird reactions, and they see everything because they take them home right after. So a lot of clients are concerned, which I think is the backside of taking them home right after anesthesia.
But they don't have to take them home. There could be a place where a room at the clinic where they sit with their animals as they wake up. I'm not saying everybody should do it, but I'm saying that as a pet parent, I would choose a clinic that allows it. And I think it's a good question to ask early on when you choose your vet, is when sooner or later they're going to need to have their teeth cleaned or something like that. Can I sit with them?
It's interesting. It is one to ask. I'm going to ask next time I'll never need to go, but
Mm.
if I do. Yeah. So we better do some questions. We're halfway through.
It was
We had
actually
any
one.
questions? Yeah, go on.
There was actually one asked in the chat here, which was Michelle. She asked, I've got a grooming client, Mini Schnauzer, who just had the spleen removed. There was a benign tumor. He's also diabetic. Any advice going forward? So I'm assuming she asked, what should she advise this person to do going forward?
How old was the dog?
Doesn't say.
Well, we definitely need to look at why the dog is diabetic as well. I would say something that would be what I would maybe be looking at first. What's going on with the diet there, or what's triggered this, and the age of the dog. You know, sometimes if they're older and they've got the diabetes in older age, it's more difficult to manage. But I think probably because we mentioned the spleen as well. I mean, this is exactly where a holistic approach is needed for a dog like this, because their spleen cannot do what the spleen is supposed to do. So we need to be looking at ways of supporting them. I mean, if I was working even as a nutrition consultant with this dog, I would probably be getting them to go and see a TCM acupuncturist anyway, because I would be thinking of the chi and the energy of the spleen and how could we work with that meridian, you know, even if the spleen, I guess, isn't there or isn't as functioning as it should be. So I would say this is exactly the kind of case. We need loads more information, and you need to work with somebody from the APNC if you can.
Yeah, but still think about the spleen is not in TCM. It's not thought of as an organ and how it's working, as we talked about before. But of course, there will be some imbalances if it hasn't got the spleen. And the diabetes is much more interesting in that case, I think.
Yeah, absolutely, because there may be other secondary things happening because of the diabetes. The diabetes might be secondary to something else. It's, yeah, they're kind of often a lot's going on in the body before the diagnosis is given. So it's sort of unpicking that as you go back through the history of the dog. So yeah, Michelle, if you can get your this dog's guardian to have some support, that would be really good.
Yeah, I think there's a lot of approaches to this, and I think it depends a lot on the underlying issues, and you need to see the whole history. But definitely see an integrative vet. There's many directions to go. I think probably TCM, acupuncture could be a great way to go. Looking into the nutrition, depending on what the individual needs are. I think this is a good place to add a bit of Ayurvedic medicine, maybe add some pancreas and spleen, depending on the animal. I don't know about homeopathy, maybe, Lisa.
Well, homeopathy can help most things, so I'm rarely going to say no. Well, this is not a case for homeopathy, but I think it's fantastic that the tumor was benign. You know, splenic tumors are often very bad news. So the fact that there was a tumor that didn't turn out to be a big problem is something to be grateful for. And dogs can live quite well with diabetes, but it's clearly a dog that has imbalances, and it's probably quite an elderly dog, I would assume, that could use some support.
I always think of schnauzers as elderly just because they look like little old men with their...
But also because they live forever.
Not, of course.
No, but also some of them get really, really old. They are quite sort of strong.
Yeah. They are actually,
yeah. Some of the oldest patients I've had have been schnauzers.
It's interesting.
But they can be young too.
So a while back, Amy asked a question as well. She's asking about the red fur by the dew claws, the front paws, and licking. It's not an itchy dog, but does have arthritic paws. Wondering if it's most likely nutritional or pain related, and whether the redness is likely a symptom of the licking or symptoms of something else, more so on the left than the right paw. Already fresh fed or raw fed. I just want to start off by answering the color question, because it's actually because of a molecule called perforins that is found in tears and saliva and urine. And when that is exposed to oxygen and light, they oxidize. So basically you get the color.
They're going rusty.
Yes, they're going rusty, basically.
Your dog is rusting.
Yeah. So areas that are exposed to a lot of licking, a lot of tears here, or licking off the paws usually gets brown from that. They're going rusty, like Caroline said.
I would
And
say definitely we need to be looking at what is going on pain-wise here. McTimoney chiropractor, dogs are so good at hiding pain. We totally need to be able to see what's going on there. It could even be a fascia thing that hasn't got an obvious symptom. We've spoke about fascia. If you go back on our YouTube channel, you'll find quite a few different episodes about that. So I would say we need to be looking at that, what the dog is walked with, harness or collar, or how that is working. I don't remember the type of dog actually, but yeah, I would say that is more likely to be the issue here than any kind of dietary kind of allergy, if you like.
do we know how old the dog is?
It doesn't
Or
say.
what type of dog is the dog? No,
No.
it doesn't. Because also it can be about talking from my canine flow head, a lot about like the dog using their energy with their front paws, because the way the energy system of the dog would be, they need to be using this. And sometimes they're not grounded to the floor, so the energy isn't being grounded. So that can create tension in the shoulders or just stagnantness in the shoulders of their kind of energy. So that might be something to think about. There's so many things with it. But yeah, often the type of walking that the dog is doing as well can impact it. But I would say it's more of a physical / energy field thing going on here, I would say,
Yeah.
than a diet thing.
I think so too. I think that the licking is due to pain, because I often see that they can lick the carpets, or they can lick their elbows, or they can lick their toes. And I often find when I do osteopathy, I often find that they are not as flexible as they are supposed to be. So I think it's because of pain that it's licking so much. So acupuncture actually works very well, but I have the same as Lisa that you can use it for everything, but actually it's very good for the toes as well. So
I
Yeah.
think the first step would be, if you haven't been already, to see your vet and maybe talk about having some x-rays of the if it's an elderly dog particularly, and there's a suspicion of some arthritic pain, then I would certainly get those legs and those paws x-rayed.
I
Yeah.
do not want to exclude, though, that majority of the pets that I get that lick their paws does have a food intolerance. So I think it depends on the whole history and the diet and how the gut is functioning and all that. But usually when they come in with licking paws, maybe ear issues, anal gland issues, all these things usually connected with food intolerances, very often protein, sometimes carbohydrates or other fillers. So yeah, I would definitely look into the diet. If you want to try to exclude it, you could always put them on through an elimination diet and see if it made a difference. And then, like they said, definitely check out if it could be pain related as well. Maybe work with an osteopath or someone who works with fascia as well as acupuncture. Because honestly, there's nothing else that touches joint pain as well as acupuncture, in my opinion.
And you can even go to one of the pain ones. You'd be okay to go to them rather than a TCM one if you can't find.
one of the pain ones.
That's what I would call the people that just do it for pain.
The Western acupuncturists.
Oh. Yeah, actually, that's a very interesting topic because I actually took over a lot of clients in the UK from someone who's been doing Western acupuncture, and then I kind of heard a little bit. So I feel like I have some kind of overview over the difference. And the main difference is so they would mostly put needles over the back. The course is very short. I just cannot imagine how they got through it. They basically threw the book at them and say, read this, and they come for one weekend, and then they get their certification
Oh,
of
well,
Western
I did the Western acupuncture course. It was longer than one weekend. It was several weekends over a year or something like that. But it's very much, if the pain is here, this is where the needles go, and if the pain is there, I call it cookbook acupuncture.
Yeah.
And it's boring as anything. It can help, but it doesn't.
So that's
It's
what I think, like it can maybe help the local area, it can help a little bit with the pain, but in Chinese medicine, that's kind of not what we do. Like we have our local points, but that's only one part of the treatment. Then we look at the tongue, we look at the pulse, we look at the personality, we look at the issues and everything else and their temperatures, and then we make a Chinese diagnosis. And that's the real art of Chinese medicine, is to get the correct diagnosis and treat it with the correct points. So that's more like you're treating the whole animal. If they're overheated or they're cold, you're treating that. If they're stiff and they have joint issues, you're treating that. Just generalized, not just one point that might do something for one place, or you treat the whole animal. You peel the onion, you get rid of all the energetic clogs, not just like small things, if I can, yeah. If that makes sense.
Absolutely. And I think also when there was talk of licking and discoloration, I mean, it depends a lot on the dog's age. I think if it's a young dog, it depends on the type, I suppose. It could be a dog that has joint problems at a young age, but we don't know, I don't think, whether it's just discoloration of the hair or whether it's inflamed, the skin is inflamed. And sometimes you really need to get in there and shine a light and look carefully, because sometimes, like if you get a white dog, if a Westie or someone like that comes in and they look like, oh, I think, oh my God, those paws are going to be horrible. But actually it is the fur that's discolorated. The skin can be absolutely fine underneath if it's a problem that has settled. And I don't think we know whether the skin is inflamed. Most of the allergic dogs the skin will be very sore. And it can be, I suppose, if it's a pain problem, but if it's just the discoloration of the hair, I would maybe veer towards thinking that it was licking the joint, especially if it was an elderly dog.
Definitely. Okay.
There was Carol had a question some time back as well, which is a bit of a longer one. So she has a rescue golden retriever, 5.5 years, who came to us 2 years ago with cruciate ligament disease and grade 4 arthritis in her stifle. She's also an itchy dog. We were advised to give her expensive omega-3 supplements, and after 4 months, we did a balance test, and her omega-6 to omega-3 ratio is 9.7 to 1, which seems fairly high, but I haven't been able to find a definite answer. So what should a healthy omega-6 to omega-3 balance in a dog with arthritis and skin problems be, please?
Well, it's usually about 3 to 1, but that could be any figures of what you want to be.
Yeah, exactly. Yeah.
Of what, which amount, which volume. But so what did you say? It was 9 on the
9.7
and
9.7 to 1.
Yes, that's more, but I'd be like pleased.
I was going to say you can't really get.
I'd be pleased.
Don't you just want to push it as much as you can in the right direction?
You know what? There's other things to think about. I wouldn't be worrying about that one calculation within a diet. I mean, obviously the symptoms, I say obviously, I don't know, but it sounds like the fact that the question's even being asked, that the symptoms are still there and that the dog is still experiencing all this. But if they are, I wouldn't have said it's going to be because the ALA is too high, or the omega-3 is too high. So I think we want to be talking about other things with this.
Sure. I mean, no balance of them. Yeah,
Go
no,
on.
sorry. No, I'm sorry, I didn't mean to. I was just going to say no balance of omegas is going to cure in itself arthritis or an itchy dog. Getting
but
balance better
can
can be a nice help, but it's not going to solve it. And twitching that is not going to suddenly solve it. Is the point I'm saying.
Yeah, and there's all the others to think about as well with the fatty acids, and they're so involved in other vitamins within the body. So I don't think that in a short answer is something I'd be more worried if it was the other way around.
Yeah, I think there's a lot we can do for this dog other than just the omega-3s, but I do want to mention the numbers because I have them written down. I can never remember them by head, but I have them written down. So when it comes to the diet and the recommendation, the National Research Council states that the max ratio should be 2.6 to 1 to 26 to 1, which is a very wide range. So basically means we don't know exactly what the perfect ratio is.
So they're saying like 2.5 to 1 against my 3 to 1. But I would say we have to question the NRC don't forget these guidelines are made for manufacturing.
Yeah,
They're
and then
only
AFCO.
created because of the manufacture of pet food. So they may have been lenient on themselves, given it's very difficult to
Yeah.
stable this
Yeah,
nutrient.
so 2.6 to 26 to 1. And then the AFCO guidelines state that the max ratio should be 30 to 1. But if you base it on the natural prey that canines eat in the wild, the ideal ratio is more like 4 to 1, 5 to 1, omega-6 to omega-3.
Yeah. Well, and also it's when you have a fat that's from a wild source meat, nature has created that to be in a certain way. So unless it comes from an environment where we've really changed things, then this is where you will find the optimum ratios. And if you can feed those wild meats, although this is why we like grass-fed and grass-finished, because the animals that eat those have a better chance of creating. I mean, there's plenty of papers out there to show this, that the animals that eat those have a better chance of creating the essential fatty acids balances in themselves, let alone if they're then put into the pet food manufacturing or even for ourselves. So yeah, to have those meats is I mean, now Steve C-Spot Live Longer, what's his surname? Steve, who he originally created the ADF formulator, and he's often on the Forever Dog, what do they call it? There's like a webinar series that they do, but I can't think of the name of it now. But anyway, he's your guy. Steve Brown, C-Spot Live Longer and the Ancestral Diet. These are the books that this lady should maybe look at, the canine ancestral diet. So if we can really match those natural wild source meat ratios, and then we have to think sometimes, yes, you could match those, but there's going to be things now in 2025 that are going to be more detrimental or more inflammatory than perhaps there was even 20, 30 years ago. So we have to think about both things. How can we support the anti-inflammatory mechanisms in the body, but also how can we stop the inflammation being created in the first place?
Yeah, I think
I think getting good oils, fantastic. I recommend them all the time, but I think we are talking surface stuff. We're talking reducing inflammation. Why don't we talk about getting to the root of the problem and curing the immune system that's causing the itch in the first place? So you can give all the oils you like if you're giving a leptospirosis vaccine every year, and
100%. Yeah.
So you need to see a homeopath and probably also an acupuncturist or an osteopath.
But just coming back to the question, because there is actually, for those who didn't know, you can actually test it. You can do a blood test and you can test the different fatty acids.
Well, obviously what this lady's done, I presume.
Yes, exactly. Yeah. So based on the recent veterinary nutritional science, they say that it should range from between 5 to 10 to 1. Which she is within, the recommended limit. And then if someone wonders also, can I over supplement with omega-3s? Then the answer is yes, actually you can, because it comes very importantly together with vitamin E, and you can actually become vitamin E deficient if you don't get enough, or if you give too much omega-3s without the two together. That's why the supplements that contains both are better. And I could probably talk all day about finding the right.
You know what, Tina, though, nature has solved that again by having such high vitamin E levels in grass.
Exactly.
So this, this is why we always come back. Nature knows how to do things to sustain the life that walks this earth.
Exactly. And then as a final note, some studies suggest that ratios as low as 2 to 4 to 1, if that makes sense if I say it like that. 2 to 1 or 4 to 1 between there can be very helpful with dogs with chronic inflammatory conditions. That was a lot of numbers, but Everyone says
For any
different
of
numbers, so it's very difficult for people to you know what's the good ratio. But
them.
yeah, holistic health, looking at everything. I guess is the good answer.
Okie doke.
Yeah,
Well, flying through the questions and loving it.
we really
Next.
are.
There was one from Alicia who was.
Did you see that I answered Alicia on our messages?
No, did you see
But
what she was
different.
about? No, I don't know if it's the same Alicia, but this was the question about a blood test. Yeah, I
Oh,
think she'd wanted a titer test,
oh no,
and gone to a clinic that did titer testing and was appalled with a young dog and was appalled because the vets there had tried to, I mean, and I think this was recently, so I'm quite appalled too. The vets there had tried to convince her that she should neuter her young dog, and told her that she shouldn't feed raw. And they'd done blood tests. I don't know why they'd done blood tests on a young dog, but the urea was high. And that was what the question was about. So it's just really, it's a nice opportunity to mention that urea is higher in raw-fed dogs. And I see this quite frequently, that I've seen several cases where you do blood tests for whatever reason, maybe pre-anesthetics, and then urea is high, then they're told they have a kidney problem and they're put on kidney food, which is very high in fat, and then they've got pancreatitis. And you're just thinking someone should really be aware that if you have a normal blood results but urea is high, it comes from eating lots and lots of meat, and it's nothing to worry about at all. And I had a quick look at Alicia's blood tests that she sent us and asked us to have a quick look at, and they're completely normal. Urea is a little bit high, all the kidney parameters are normal. It's because the dog is raw fed and there's nothing to worry about. But also importantly, don't go to that clinic again ever, because it's, you know, when you go somewhere and they talk rubbish to you, just you know, take responsibility for never going back there. It's going to be another 3 years before that dog needs a titer test, so you've got 3 years to find a different place to get it done. Don't go back.
I agree. I mean, we actually teach our consultants as part of the mentorship about reading blood tests and to understand where the parameters came from. And obviously, for a long time, there hasn't really been as many raw-fed dogs. So these parameters aren't really designed for what I would call is probably a dog that's quite healthy, you know, healthier.
They're based on ultra-processed fed dogs, basically.
Perfect, exactly. This is the thing. So I would go to someone who can understand those results and sort of read them from that point of view as well. And be able to see, as Lise was saying, it may be that the urea is high and you go, oh, actually, that's fine. Now you've heard us say this, but there was another niggly parameter that actually was an issue. So, you know, it's having somebody to look at them that really understands about raw-fed dogs and the whole results.
Exactly. Should we do one last question?
Yeah.
So
Gosh,
Deb
time
had,
flies.
yes, Deb had a question. I know we answered a lot of yeasty ear questions already, but which you can watch in our previous videos. So, but Deb asked, I have an Anatolian Shepherd or Chow Chow mix. He gets yeasty ears a lot. I'm looking for something other than the rinse and the drops, mainly because every time he gets this, I have to take him to the vet and it ends up being $200 bills and he ends up with the same medicine. That works for about a month or two, and then we're back to the head shaking and itching. I wonder if I could give him oregano oil, and if so, how much? He weighs 100 pounds.
Can I please answer that one?
Go on.
Because I'm
Go on, Lise.
I really think we get so many questions about, you know, what should I put in my dog's ears and what should I, and I just want to say very clearly it's the wrong question, because it's if a dog gets recurring ear infections like that, your dog has an allergy. I mean, that is the definition. Recurring ear infections means allergic dog, and it's going to be scratching the surface, symptomatic treatment. It doesn't really make that big of a difference to me whether you're putting steroids in the oil in the ears or vinegar in the ears or whatever so-called natural stuff you're putting in the ears. You're scratching the surface and it's symptomatic and you're not getting to the bottom of it. If you have a dog with an allergy, you need to see a homeopath. Or possibly, I'm sure TCM acupuncturists can do that as well. But you need someone who who know the tools that can go in there and regulate the immune system so the allergy is cured, because that's never ever happens in conventional medicine. Any conventional vet would agree with that tool set, allergies are incurable. So you'll be treating those ears forever, and you can have lots of good advice about what to put in them. It's going to be going on forever. So I would really like to stop that conversation about what to put in the ears and just see it as a sign that there's an allergy here. Let's find a treatment modality that can cure the allergy.
I mean, it could be that there's inflammation going on in the body.
That's sure, but that's what the allergy is. That's what the allergy does.
Yeah, often very young puppies, when they've just had one of their vacs, can end up with ear stuff, which isn't necessarily an allergy straight away, is it? It's
the immune system overreacting,
yeah.
And maybe it can be transient, but this clearly isn't in this case
at all. No. Well, it could have started like that, and it's just never been sorted. And at risk of Lise spanning me forever, the only yeast product that I have genuinely seen that really, really works is the Propythium.
And I think those products are great as an
you mustn't
interim.
Get that as, yes,
exactly.
Instead of solving the issue, get it as well as solving the issue, because that not only that, it's like a sticky plaster then, because other stuff will be going on, and cells turn cancerous if inflammation isn't looked at, and there's definitely going to be inflammation going on for this dog. So don't sticky plaster, but do use something that's going to alleviate any pain that the dog might be going through.
And also that's a really good point you're making, because symptomatic treatment is fine. Symptomatic treatment is always okay. I think steroid ear drops, systemic steroids, painkillers, whatever needs to happen in terms of symptomatic treatment is fine. There are just some conditions where if that's all you do, it's what I call firefighting, and sometimes it's really necessary and you need to do it, otherwise the animal suffers, but it can't be the only thing you do, because then you'll be doing it forever. So, do all the symptomatic treatment that you need to do, but get to the root of the problem at the same time. Otherwise it's going to be a very long story about dealing with itchy ears, or however that particular allergy shows itself.
Yeah, you have no idea how many clients I get in with itchy ears, and it's like, oh, I've been here almost every month for like years, and then nobody's ever looked at anything other than the ears. They keep getting ear drugs, it's always the same story. And I'm like, okay, firstly, this is most likely due to an intolerance. You most likely have a dysbiosis. We most likely, need an elimination diet to repair the gut, probiotics, omega-3s. There's
you need a plan with all those.
You need a plan.
That's such a nice way of saying it. You need a plan, and the plan isn't just what to put in the ear.
No.
Yeah.
But can I just say to Brigitte, while we've still got a few minutes, in terms of the meridians, a lot of them go round the ear or near the ear, don't they? So how does that relate? If you're working with an animal that's got sort of these chronic immune issues that are showing in the ear, what would you do for that acupuncture wise?
Yeah, but there's several things to do, because I think, as Lise does, that we have to get into the core of the problem and change the diet and so on. And that's true that we have several ear points around in front of the ear, and they are very good actually to use for ear problems. But we also know that if we have to dissolve the allergy, we have to make it better, we have to choose points on the body that work in general. And it can't be some of the meridians that are around the ear, but it will probably be a spleen stomach point as well, because everything is, in my opinion, comes from a spleen stomach imbalance. So it's where we're going to treat. So it's much more interesting to use the general points on the body, and perhaps some local points. I sometimes use the local points, but I'm more fond of using the general points to make a difference for the core problem, actually.
I just wondered how much, say, the gallbladder meridian that goes around the ear, how much the gallbladder as an energy was related to this, because the liver, of course, is so much. So whether the gallbladder is, and then that is partly as well why it shows up, it could be another layer
Yeah, I
What's
think the gallbladder is very often related to pain because the gallbladder is one of the very long meridians go all through the body, and we see a lot of pain where the gallbladder meridian is actually lying. So I don't think gallbladder is that interesting in regards to allergy. There's also a triple heater point, and triple heater is more about that the energy is not. It's like I heard a good analogy once, and that was triple heater is responsible for traffic jams, to sorting the traffic jams. Also, is gallbladder as well. So if there's stagnation somewhere, or there's more energy in top of the body and than in the lower body, we have to get the energy rolling, and that's triple heater and gallbladder is responsible for that.
Do you
That's
ever
really crazy pictures, but if you understand it, it's so nice.
But is it also true, Birgitte, the way it is in homeopathy, that if you have a dog that comes in with itchy ears and you think this is an allergic dog, I'm going to try and cure this dog, that you could have 50 dogs with that exact problem, but because of who they are, they might need 50 different treatments.
Yeah.
Yeah.
Yes. Yes. It is like that. I mean, we have so much other stuff to look at, like the temperament and how they live and age. And I mean, we could keep on. And there's only 30 seconds left or something
Yeah.
like
Tell us how to cure allergy in 30 seconds.
Yeah.
See a homeopath or an acupuncturist, I would say, and then it's less important what you put in the ear.
Yeah.
Yes, we're out of time.
We don't.
Thank you very much, Birgitte, for being with us again. I can't wait for your book. We will put it on our website when it's out, or on our Facebook page when it's out.
Okay.
But you'll be back before then, I'm sure.
Oh, thank you. Thank you for inviting me.
Thank
Nice
you.
to see you.
Yeah. Excuse me a minute, I'm forgetting how to stop.